Thank you, Ms. Queenie. We have now come to the question and answer segment. So together with my team, we have selected several questions from the Facebook comments that we will post to our speakers. So we'll go in order. Feel free to still send in your questions at the moment. We will still read them and we'll feedback to the speakers accordingly. If need to, we can reply you after the event itself. Maybe we start off with a question for Uncle Tian Sing. Thank you for your presentation. The approach that you gave seemed to be focused on how we as believers of God or as Christians can cope with our own mental health issues. How about the others, helping others? How would you say the Bible advises us to help friends with mental health issues?
I think that's a very good question on how we can help others. I think that the first important thing, of course, is compassion. The need to help others, people around you, whether they are Christian or not, the community, understand that people need help. Queenie mentioned about the social support, which is a very important part. A lot of people will not go and see a doctor or a counselor because there's a lot of stigma about surrounding going for professional help, cause concern and that thing. Actually, people will always go to your friend. Friends are the first, the first aider. So I think in terms of helping people, I think the first stage is being a friend and to help. And I think just because of various people talk about the importance of understanding the issues involved and how not to be judgmental, be empathetic. I think one of my slides talk about being empathetic, and from the Christian point of being patient. Now you get a flu, it takes about 4 or 5 days to get well. Remember talking about depression, it takes 2 weeks to recover, right? And some people take longer. And I think we have to be very patient with people, understanding that we are not going through the same thing, and always to be patient and encourage them to continue to seek treatment if they need to, and it will take time to recover. And of course, a lot of prayer, and a lot of godly counseling will help the person to actually move along. A lot of things that a lot of us need actually a lot of encouragement to get things done. And especially when you're very depressed, you don't feel like doing anything, right? And you think that there's no way out. So from the Christian point of view, there are a lot of important part that we can motivate people from the Word of God, the promises, from being there and being praying for them, and be very, very understanding. The worst thing is to come across very impatient and judgmental, and then people will just go away from you. That's what I think.
Thank you, Uncle Tin Sing. Yep, certainly that advice is timely, and we should use the approach to pray for others and use to teach them about the promises of God to encourage them so that they can have some relief from their mental health problems. The next question is actually a question from Sister Kim Chu, derived from the Facebook comments. She asks, this is question directed to Ms. Audrey, the second speaker. She asks, do you observe in your interaction with the patient that whether there's a stigma associated with mental health in Singapore today? And if so, what can the government do or what can society do to improve on that?
Thank you for that question, Sister Kim Chu. I think the stigma is definitely still there, and I think that there is definitely more awareness now. I feel that there's still room for improvement in terms of the society, in terms of the government to especially help to enhance the policies. For example, coverage, medical coverage. I think it's also important that we have that in place so that people will be willing to come forward for treatment. People will be aware that there is a subsidized care. Because a lot of times patients with mental health problems is a lifelong conditions, and they may need a longer time of monitoring in terms of their outpatient or in terms of their treatment. So I feel that our government has done a lot, I would say, for at least for the past 20 years. But the stigma is real. The stigma is still there, and I'm afraid that it may not 100% go away. But I feel that we have, as long as there's more awareness, which is why we are having this platform today, to educate the public, to let the public know that, hey, having mental health problems is not something to be ashamed of. It is definitely treatable. There is a help available as well. So I feel that this is important to let the rest, let the people around us to know that this is so. Yeah.
Thanks, Miss Audrey. Yep. I hope that answered the question, Mr. Kim Chu. Next question, I think is also from the public. Sorry, from one of the church members. I think it's from Yen Ling. This question is directed to Ms. Queenie. She's asking, apart from the helplines that are currently available, are there existing social support groups for recovering mental patients or their caregivers?
Hey, thank you for the question. Yes, there are. Usually, these are the support groups that are under those mental health organization. Yeah. So if we are interested to find out more about the program, or whether the social, the support group is running in this period of time, it's good to call up the helpline so that the professionals can help to link up and do the referral. Yeah, but we in Singapore there are social support groups for both patients and caregivers lah.
Okay, I think we'll take two more questions. Next one is also directed to Miss Queenie. It's a combination of a scenario together with a hypothetical question per se. So for example, maybe you saw one of your colleagues or your friends, and he was actually popping pills, trying to overdose to commit suicide. You asked him about it, but he begged you not to tell anyone for fear of stigmata and for fear that people will shame him. He says that he has changed and has no longer any suicidal ideation. What should you do, especially if he refuses to seek medical help?
Thank you for the question. I think for this case, right, we will, because I think we certainly have reports with the colleagues, like if we know that, the colleagues popping pills or like even overdosing, I think then we have to do our own due diligence and do the assessment to see whether, it's life threatening, because I think we don't want any risk to happen. And I think in case that it's a life-threatening event, we have to tell the colleagues that hey, let's go to see a doctor for medical advice, and I will go with you, and we will, and as much as possible we hope to keep it confidential, but let me go with you. Yeah, so I think as long as you show the care and genuine, I think the person can feel it and can understand. And also, I think do not be afraid of breaking the rapport or breaking the relationship with the persons. Simply show them or simply tell them that I'm sorry, I know you trust me. So that you tell me, you are having these situations, but I really do care and I'm really do concerned about, the situations. Can we just go and seek medical attention? Maybe just let the doctors take a look at how are you currently, and then so try to convince the people lah. Yeah, so I think in situations like this, or like high risk urgent situations, we still have to balance, and we have to call the emergency helpline, or we have to bring the persons to go and seek for medical help lah. I'm not sure Audrey have anything to add on.
No, you pretty much sum it all.
Okay, I think the next question will be directed to Ms. Audrey. One of the members of the forum was asking, is mental illness actually preventable? Can we do anything to prevent ourselves from getting this anxiety, depression, etc., etc.?
Thank you for that question. I think this question is quite relevant in that sense that mental health is so important to talk about. I think the first step is we must be aware that when we are stressed out, and when we are stressed, how do we manage the stress? I suspect the trouble is many of us know that we are stressed and we don't know how to deal with it. We don't know when to take a break. We just keep pushing ourselves. And then as a result, many a times we do have people who just break down because they realize that they have been stretching themselves too much. Yeah, and so the key, I feel, that to recognize, to prevent mental health problems, I think is really to know that, hey, you know, I'm actually at this limit, I'm overwhelmed, I'm swamped, and to take a step back to actually then realize what is happening. Is this a depression that I'm dealing with? Is this the anxiety that I'm dealing with? Or it's just because I don't know how to say no. I didn't know how to say no, and I'm just taking everything on together. Or there is a problem that I'm not knowing how to deal with it, and it's troublesome and it's getting the nerve out of me, for instance. So in a quick sense, I feel that if you know what's the problem, you get help early. Early help is important. Then it should not become a illness. It should not become a disorder. Having said that, of course, self-care is very important. I can't emphasize on that. When you are stressed, you need to work on those issues as well. What is the one that is driving the anxiety? What is the one that is driving the depression? When we know what it is, we are able to deal with it. And many a times, things like self-care really, really helps a lot. It really will reduce the stress quite tremendously. Yep, I hope that answered that question in that sense.
Yep. Thanks, Ms. Audrey. Certainly, yes, self-care is very important, and I think that's one of the key things in managing our own mental health, so that we can perhaps prevent ourselves from getting to mental health issues next time. We have two more questions. Next one is for Uncle Tien Sing. This question is about an individual who is depressed but doesn't have very good social support and cannot commit to seeking professional help. Essentially, this individual may be a Christian. He may be telling the elders or the senior people in church, I prayed to God, I read the Bible, I still do not feel happy. What advice do you have for him?
I don't think I have answer for that, but certainly you can think about a person in that kind of situation, whether suffering from anxiety or depression. It's a very strange thing. Sometimes, when you are sick, you don't want to seek help. You just want to be sick. It's a kind of thing. And then especially in depression, right? People can't get out of it. So they just keep going down and down, spiral down, and want to meet people. And one of the things is that they don't want people to know they have this kind of situation. And the fact that they don't want to contact anyone actually make it very much worse. And so I think as from the helping point of view, I think this seminar is important because we get to understand what all these things is about. Right? It's not something so mysterious, but as we are more aware of what depression is or anxiety is, we are more capable to help people and know that they are going through a situation that you really need to be very patient with them. So I think the first thing is to support them, to be there for them, until they are ready to respond. And if you are suffering that, I think this seminar also is important because we may get into this problem, and then the kind of awareness that's important, because if we're not aware that we are sick, then we will not go see a doctor, right? So if we are not aware that we have depression, anxiety, we will not seek help. A lot of encouragement and to tell the person that actually the effort will pay good returns. Doing something for yourself is a responsible thing to do, for yourself. Because if you don't do anything, nothing will get better. And also the other part is perhaps to motivate the person that, if you do something about it, you'll be a better mother, you'll be a better worker, don't you think your family deserve, this thing that you do for yourself? And if you could care for yourself and do something about it, a lot of people around you will feel better, and will benefit from your self-love to seek treatment. So I use various way to like motivate the person to see why he need to seek help. And I think the different thing is that like I experienced talking to some people is that they don't want to seek help because they feel that it takes too long to see improvement, and that's where a lot of prayer and a patient is. So I hope this will help to answer the question the person had.
Thanks, Uncle Tian Sing. Actually, on that note, since you're talking about too long to recover, one of the questions from the audience is, like, what is the average time frame for recovery for depression and anxiety, and how should the family members or the loved ones of these patients with depression and anxiety help them in the interim? Very often, these family members are very anxious for the patients. They want them to get better quickly. They will say things like, "Oh, why is he not better after this session? When will he, go back to normal?" How should the family members approach this issue? Maybe this question goes to Miss Audrey.
That's a very good, relevant question as well. So usually, by and large, we will tell the person and also the family that it should take about, okay, it sounds quite long, but it's about 6 months. The reason why 6 months is important because this 6 months will determine the stressors that causes all this anxiety or causes depression, which takes time to solve. Like for example, grief that caused the depression. It's not like it will go away within 1-2 weeks. Sometimes psychological work can take some time, meaning it can take weeks and months. Therefore, you realize that a lot of times we will tell a person with who is receiving treatment, they should continue treatment for at least 6 months, and it could be even up to a year as well. That we will see them being back to their own state again, and being back to their normal state again. But having said that, we do have people who have shortened, in fact, they recover even faster than 6 months. So sometimes we can see them getting better within 3 months or 4 months or so. But I think due to the illness, the nature of the illness, we have to be realistic in that sense that we tell them that it's a combination of medication, it's a combination of therapy, it's a combination of the way how they work through their challenges, which is time needed. So you can't rush them, you can't give them the pressure that they must be well the next morning or be well in 2 weeks time. It doesn't work that way, unfortunately. So I think as a caregiver, they need to understand that this is an illness. They will need time to recover, and time is often very needed. So many a times I also remind the caregivers that we got to be patient, because the person needed that time, and if you rush them, it will just give them more pressure. They will feel that they are not able to grieve, for instance, or to recover at their own pace. And many a times it will just even make them more stressed out, because the need to meet expectation, the need to be well first, because of the family members. So I think that's very important to talk about as well.
Thanks, Ms. Audrey. Yes, I think if we have family members who have mental health issues, we need to be patient, and time is, as they say, time heals all wounds. So we need to be patient with these kind of things. We'll end up with one final question. I think this goes out to Ms. Queenie. This is, we've talked a lot about patients. Now we turn our focus to maybe the caregivers. Sometimes as the patient recovers, as you know, with patients with anxiety and depression, they may be violent or they may be a bit abusive towards their caregivers. How do you, as a caregiver, how do you draw the line, or this has to stop, I can't tolerate this anymore? And how do you prevent yourself as a caregiver from also, getting mental health issues as well?
Thank you. Yeah, I think that this question is kind of linked to just the questions that Audrey was answering. I think as a caregiver, I think definitely it's not an easy journey to support, you know, especially your family members that you are staying with them, you are seeing them every day. So it can be quite exhausting and tiring and frustrating as well, especially when, you know, this happened again and again, or even after the treatment, then why, you know, she is still behaving in certain ways. Yeah, so it can cause a lot of frustration and even family conflicts and relationship problem as well. So that's why we often when we see patients, we also talk to the caregivers about their own psychological well-being. So if they need help, we don't we are not only providing support to the patient themselves. We are actually also providing support or even like counseling, emotional support to the caregiver as well lah. Yeah, so I think in regards to the line that, you know, where should we draw it to support the family who is abusive, who is violent in the family, I think it's definitely important, and it's the priority to protect yourself first. Okay, because I think without that, you can't even care for your family members. I mean, you're not safe. Yeah, so if your family members exhibit any, like, you know, harmful or violent behavior, it's good to get help from the medical professional, yeah, to see whether, you know, further titration of medication, any other therapy, any other behavioral therapies that can help with that lah. Yeah, so I would say safety to the individual is really very important. Yeah, so be it the person is your family member, is your close friend and things like that. So you have to protect yourself first. Thank you.
Thanks, Ms. Queenie. I think that's all the time we have for questions today. At this juncture, I'd like to thank you to all the participants for all the interesting questions. I think we have learned a lot about mental health today. We have now come to the end of our health webinar, and the organizing committee would like to express our appreciation to all the speakers, Uncle Tien Sing, Ms. Audrey Wong, and Ms. Queenie Chow for their knowledge and for sharing their knowledge and experiences with us. On behalf of the Limapin Road Church of Christ and the Eastside Church of Christ, we have prepared tokens of appreciation to our external speakers, and these have been given out to the respective speakers earlier before the talk. Lastly, the next slide will show a QR code for the survey. This QR code gives you the link to a survey, and this is where you can give us feedback and suggest topics on where to tell us how we can improve, and you can suggest topics that can be used for future health webinars in future. We will also share the survey link in the Facebook page comment section. And lastly, and most importantly, we are thankful to God for this outreach opportunity. All glory goes to Him. If you have any questions related to the Bible or would like to know more about the Church of Christ, please get in touch with us, and we'll be more than happy to assist you in any way we can. These are the contact numbers the contact email websites for the Limapin Church of Christ as well as the Eastside Church of Christ, and these are the details for the worship services and the Bible classes. With this, I'd like to thank everyone, and we'll end off today's health webinar.